30 Action News Jax is uncovering hospice horror stories. New federal data shows hundreds of hospice care providers have been cited for some major violations affecting patient care. Justin Gray is live from the Action News Jax Bureau in Washington. And Justin, federal auditors are sounding the alarm about what they're calling gaps in hospice care.
Yeah, we're learning really disturbing specifics about some of the mistakes found at hospice providers. 20% of hospices found to have serious deficiencies. A wound left untreated on an Alzheimer's patient for so long that a leg became gangrenous and had to be amputated. Maggots found around another patient's feeding tube. Both patients failed by hospice providers. That end-of-life care paid for by Medicare.
These examples are heartbreaking. This is one of the most vulnerable populations, terminally ill patients in their final days.
The Health and Human Services Inspector General found these were not isolated incidents. The federal investigators say that 80% of hospices were found during on-site inspections to have at least one key deficiency.
These aren't just technical deficiencies. They can really affect patients.
The IG labeled 20%, or about 300 hospices, as poor performers with more serious deficiencies.
In some cases, we found that the hospice care actually harmed the patients.
In Florida, 95% of the 44 hospices surveyed had at least one deficiency. So which hospices are the poor performers? Right now, much of that information is not being shared with the public, and some of it, by current law, can't be. The Inspector General is recommending Medicare set up a more transparent system where you could easily search a website for any violations at hospice providers like you can with nursing homes. Now, that would also require new legislation in Congress to allow all of those inspection results to be made public. Reporting live in Washington, Justin Gray, CBS 47 Action News Jax.